Welcome to episode 27 of the Progression Health Podcast. This is part of the Mental Health and Mindfulness series, and I'm here with researcher Manoj Sharma. Manoj, would you like to introduce yourself and tell us a little bit about your work, please?
Thank you, Ross. My name is Manoj Sharma. I'm a public health physician and an educator. I have a medical degree from University of Delhi and a doctorate in preventive medicine from the Ohio State University. I'm currently working as a tenured full professor and chair of the Social and Behavioral Health Department in the School of Public Health at University of Nevada, Las Vegas. I also have a Master's Certified Health Education Specialist certification from the National Commission on Health Education Credentialing. And I have a career spanning over 30 years in public health, in which I have trained over 6,000 undergraduate and graduate students, that include physicians, health education specialists, dietitians, community health nurses, healthcare administrators, epidemiologists, sanitarians, health and development workers, allied health professionals, and others. And I have taught for 13 national and international universities, working full-time or part-time. In full-time universities, I have worked at the University of Nebraska at their three campuses: University of Nebraska at Omaha, University of Nebraska at Lincoln, and University of Nebraska Medical Center. And then I have worked for University of Cincinnati and Jackson State University in Mississippi. Now I am with University of Nevada, Las Vegas. And in terms of my public health experience, I have worked with all levels at the local health department. I used to work for City of Columbus as health promotion supervisor, worked with City of Cincinnati Health Department and many other local organizations. I have worked for state health departments, the state of Ohio, state of Nebraska, Ohio Commission on Minority Health. I have worked for federal government agencies like Centers for Disease Control and Prevention, US EPA, NIH, for not-for-profit organizations like American Cancer Society, American Lung Association, etc. And then professional organizations like American Public Health Association, American School Health Association, and international organizations, including governments of other nations like European Union, World Health Organization, Associazione Italiana Amici da Raoul Follerio in Italy. And I have been a keynote presenter at several universities like Chongqing Medical University in China, University of Arkansas, University of Oklahoma. And I have published 13 books and over 340 peer-reviewed journal articles and more than 450 other publications. I am ranked in the top 1 percentile of all researchers globally in the world in 176 fields. So my research interests are in developing and evaluating theory-based health behavior change interventions, obesity prevention, stress coping, community-based participatory research and evaluation, and integrative mind-body-spirit interventions.
We're very lucky to have someone as experienced as you on the podcast. Thanks again for making the time. So Manoj, what led you to your work in medicine, public health, preventative medicine, and your current research?
Yeah, so while in medical school, I was always interested in the preventive aspects of things, instead of the curative aspect, because curative is there is a story that I heard in the medical school of a person who was trying to jump in the river and save people from drowning. But somebody said, why don't you go up the hill and find out somebody who's pushing these people in the river? So that is the basic philosophy of preventive medicine. And you see that all the lifestyles are so important. Cardiovascular disease, for obesity prevention, for cancer prevention, all the lifestyles like healthy nutrition, exercise, physical activity, not smoking, not drinking, those kind of behaviors are the most important. So that led me to the journey of health behavior research. Initially, I started out in India. I started working with training of trainers. I worked for an organization called Voluntary Health Association of India, which was a federation of more than 4,000 not-for-profit groups. And I traveled all over India conducting training programs about starting health initiatives and building a cadre of trainers. Then I wanted to systematize my learning in public health. So I moved to United States and did my doctorate in preventive medicine from the Ohio State University. And while working for my doctorate, I was working as a health promotion supervisor for City of Columbus. And I was appalled to see that the funding for public health was very scarce. So I designed some healthy lifestyle program called Building Healthy Lifestyle Programs with the limited budget that I had. And that program was chosen as the best health promotion program in Ohio. And I wanted to, after my doctorate, I wanted to move into academia. So to train other students to build the new generation of public health professionals. So I moved into academia, and here I am for the last 25 years. I'm working in academia.
Wow, so you have a wealth of experience. So just going back to preventative medicine, what are some of the, so for listeners, what are some of the common issues you see in people's lifestyles that, lead them to having health problems? What are some of the kind of common, issues in, let's just say, the US lifestyle in particular?
Yeah, the US lifestyle, the nutrition is a big issue because we do not eat enough fruits and vegetables in our diet. A lot of surveys have shown that the recommendation of 5 cups of fruits and vegetables, like 2 cups of fruits and 3 cups of vegetables, is not being met by a substantial proportion of the population, as high as 85-90%. So, and also overeating is a population, large portion sizes in our diet is a big problem. And we think that our diet is deficient in proteins, so we consume large quantities of meat, which is not the case. And also sugar-sweetened beverages consumption is a big issue. So that is about the high fat, saturated fat also is an issue. So that is, and high salt intake is also an issue. So those are about the nutrition part. And with the physical activity, we are not meeting the adequate guideline of at least accumulating 150 minutes of moderate intensity physical activity per week. We are busy with sedentary lifestyles. We have a lot of dependence on automobiles. Our jobs have become very sedentary. So as a result, we are not getting adequate exercise in our system. And high-risk groups are the minority populations. I've worked with African American women, I've worked with Asian Americans, worked with Hispanic Americans, and they are the ones who are suffering a lot in this area. And then, smoking is still a big issue. We all know that tobacco is harmful for us, yet number of people engage in smoking, and now vaping has become an issue, especially with the young generation. So that is pretty harmful. And also the issue of alcohol. In our society, alcohol is part of our living, but alcohol has a lot of harmful effects. In fact, a number of studies have shown that any amount of alcohol consumption is injurious to health, and there is no safe limit of alcohol. Like some people say, oh, I'm a moderate drinker, and that is protective, but studies have shown that that is also pretty harmful. So alcohol drinking is a big problem in our society. Then sun protection behaviors are an issue, sunscreen use and tanning and those kind of behaviors are problematic. And then safer sex practices are an issue in our society. People are not monogamous in their relationships, and as a result, they engage in unsafe sex behaviors. So that can lead to a number of sexually transmitted diseases, including HIV/AIDS. So that is another big behavioral issue. And then recently, a lot of interest has been shown in social determinants of health, like education, employment. There are some communities that are disadvantaged in terms of these societal factors. And there are a lot of racial disparities, a lot of gender disparities, a lot of other forms of disparities. So I think both health behaviors, lifestyle problems, and social determinants of health are the main preventive problems. Some of them require individual level interventions, while some of them require structural level interventions, both at the educational level and at the policy level.
Yeah, very interesting. You've given a lot of food for thought there and a lot of things that people can work on. I just have a few questions, kind of little questions that all arise from everything you've said there. So just on the nutrition. So, you say about eating more fruits and vegetables, but some people would say, like listeners might say, oh, but fruit, it's high in sugar. Is it not bad for my health? What would your opinion be, on fruit in the diet?
Yeah, fruits do not have the bad sugar. They have the healthy sugar part of it. Of course, I am not advocating for excessive consumption of fruits, but according to the USDA and other authorities, they say 2 cups of fruits per day. So fruits are rich in antioxidants, a lot of vitamins, and they are not so high in sugars. For example, you have strawberries, blueberries, they're not high in sugar. And the kind of sugar that they have is not very harmful, as opposed to the sugar that we put in our beverages, like derived from corn and all. That sugar is pretty harmful. But the sugar from fruits is not that harmful, It's pretty useful. And we need some amount of carbohydrates in our diet because they are the main source of energy. So we should not follow any extreme diet. Like I see some people following an all-protein diet that is pretty harmful. And studies have shown that can lead to development of cancers and things like that. So we need a balanced diet that is balanced in carbohydrates, in proteins, some fats, vitamins, minerals. All those things are very important. Water consumption is very important in our diet. We should consume at least 8 glasses of water every day. And I see that number of people don't consume enough water. So having adequate portion sizes is also important, like I was mentioning with the fruits part, that not over-consuming fruits. And fruit juices are not recommended because they have added sugar in them. Some people say, oh, I drink a lot of orange juice, or I drink grape juice, or such and such juice. That is not good. You should try to consume the raw fruits, and that's a healthy way to do it.
Brilliant. Yeah. So the juices themselves, they're too compacted with sugar, but then the fruit in its natural form is healthy, and that's very good to know. It's a good reminder. What's your opinion on frozen fruits? Because their shelf life is longer, and I think a lot of people would say that having fruit around the home, I forget to eat it or it goes off. But if it's frozen, you can have it, whenever. Really, it lasts a lot longer.
Yeah, I think frozen fruits are a good source because most of the nice properties of these fruits are preserved in frozen medium, and you can make things like a smoothie, add it with milk and make a smoothie, don't add any extra sugar in it. So that is a convenient way of consuming fruits, So I would advocate for using frozen fruits if a person wants to do that, because it prolongs the shelf life, like you mentioned.
Yeah, absolutely. It's much more practical and effective. Actually, I find it can be cheaper as well, which is great.
Right.
So meal prep services, they're a new thing recently that I see a lot of, especially here in San Francisco. You pick your meals and they deliver a prepared meal in advance. Do you think this is a healthy alternative for people who are maybe busy or they just don't like cooking?
Yeah, with already prepared meals, you have to be careful with what preservatives they're using. And also the amount of time that you spend in cooking the meal reduces your appetite, so you don't consume a large portion size. So I'm an advocate that you should buy raw vegetables, raw raw food products, and then start the cooking right from scratch. I think everybody has a lot of time at their disposal these days, and it is a pseudo myth that people assume, oh, I am so busy that I do not have time to cook. So one should take the time to prepare the meals from scratch, and that way, it's cooking is a very good hobby also. So you can also learn the art of cooking, and while you're cooking, a lot of your appetite gets satisfied in the process. So you don't tend to eat a lot. So you should try to cook the meal, take the time, at least 25, 30, 40 minutes cooking the meal and spending at least 25, 30 minutes eating the food. Sometimes we hurry up while consuming the food, and that is also not very good. We should chew the food very carefully so that all the with the mastication, the saliva, which has xylem enzyme in it, it dissolves the food and extracts all the nutrients from the food. So one should chew the food so that it becomes like a fluid before taking it in. So most of the time people are in a hurry and they just, you see people munching the food while driving a car. So that is not a very healthy practice. So one should take time to prepare the meals. One should take time to eat the meals, and then eat in moderation. So that is something I would recommend.
Yeah, absolutely. I think when you cook your own meals, in my experience, you appreciate the food a lot more.
Right.
It's almost like that hunter-gatherer idea where
Right.
we're not hunting for the food, but at least we're putting the work into, sort of gather it and prepare it. And
Right.
then, I think being grateful for the food you have is a lot more important.
Yeah.
And then you can be more mindful of the food you're eating, like you're mentioning, instead of eating in the car. If you can be aware of, okay, maybe I'm full now, or actually I want a bit more, then it reduces the chance of overeating and long-term then obesity. So that's a really good.
And
really
your topic is about mindfulness. So while eating, if you're conscious that you are eating the food, that is a very important thing, rather than your mind loitering elsewhere, like, oh, what have I do with my job? Or what is the next deadline I have to meet? Or what is running on the TV? So our mind is distracted. So when we are eating food, we should engross ourselves in eating food. And that is a practice, in India, when we eat food, we focus only on the food. Whereas in the West, in United States, what I have noticed is that we gather around and we talk a lot on issues while eating food, like it's a gathering on the dining table. In India, it's a practice which is more individualized, where the person consumes the food, he or she is totally engrossed in the eating process. Whereas here, you are distracted a lot. So I am not sure, a lot of research has been done in that regard, but perhaps that is something we should do, because the mindfulness research is emerging that whatever task you do, you remain in the present, and that is pretty helpful. So a lot of evidence with mindfulness is there. So I think with eating food also, we will be able to do such research, and that will be pretty helpful.
Yes, absolutely. Yeah, you reminded me, when I was back in Ireland, I had a few Indian friends and I had a few meals with them, and it was a very, big social occasion, but there was like the TV wasn't on. It was like everybody prepares the food together. And then there's not a whole lot of talking when you're eating the food. You're kind of just enjoying it. So I think that there's a lot to be said for that, because your body will tell you when you're full or when, you still want to eat a little bit more, and then can prevent overconsumption, which is a big issue right now.
And another practice that is common in India is that people eat food with their hands. So the rationale behind that is that you put energy into the food. But if in the Western culture, it is not acceptable, then that is also okay. But all practices, cultural practices, should be understood in the context from which they arise. So that cultural role is also very important.
Yeah, exactly. Yeah, like we have traditions for a reason. There's definitely some use to them, and I think the tradition now of having the TV on or watching something or having a deep discussion while you're eating here in the West is not effective. It's
right.
It's
right.
definitely contributing
definitely
to health problems.
Hurried eating is not really good. Like you are driving a car or munching on a sandwich. That type of practice is certainly not the way to do.
Yeah, absolutely. Like fast food, terrible idea. The food quality is poor.
You drive through, you pick on your lunch, then you are munching in your car. That type of practice is to be discouraged.
Absolutely, yeah. You save time, but it comes at the cost of your health. You're eating too much. You're eating poor quality food, and long term, it has terrible effects on our health. And just another point on the nutrition. So just alcohol. So just how damaging is alcohol for our health? And have you found any effective ways to improve people's relationship with alcohol or change how they consume alcohol in any of your programs?
Yeah. So with alcohol, as you know, of course, everybody knows that it causes cirrhosis of the liver if consumed in high quantities, and hepatocellular carcinoma, and a myriad of other issues are there with alcohol. What alcohol is it's a CNS or central nervous system depressant. So why do you want to depress your central nervous system? The whole purpose of life is to activate the mind to its full potential. That is the whole purpose of life, or the meaning of life is to activate your mind to its highest potential or highest acme. So why should one want to depress the potential of the mind by consuming alcohol? So it doesn't make logical sense to do that. And what alcohol does is it starts suppressing the centers starting from the cerebral cortex. So the first thing that happens with alcohol is that your inhibitions go away and you start feeling that a little bit of euphoria. All my inhibitions have gone and I am little high alcohol. And then it starts shutting down the lower centers, the limbic system, and the medulla. And if consumed in large quantities, it can lead to complete shutting of the respiratory center and the cardiac center. So death can ensue. So binge drinking is very harmful, which number of youngsters engage in. And and drinking and driving is a big problem in our country. People consume alcohol, and of course, the concentration behind the wheel is totally disrupted. So I think that is also pretty harmful.
Yeah, absolutely. It's really like a recipe for disaster when you drive and you drink. You're putting your own life at risk, and then also people on the road as well. So Manoj, you mentioned the recommendation that all adults do 150 minutes of exercise per week. Could you just speak a little bit about how you got adults in your programs to hit that mark, and just also where they're currently at? Like what's the current level of activity, and then how you got people to hit that recommendation?
Yeah. So with physical activity and exercise, the recommendations are that per week, at least 150 minutes of moderate intensity physical activity should be undertaken. Now, that is a big challenge for some of the minority groups and the other highest groups that we have in our population. So I've been working with several health behavior theories to increase the amount of physical activity that these populations they get. So initially, I worked with the social cognitive theory. Social cognitive theory is the triadic reciprocity between personal factors, environment, and the behavior developed by Albert Bandura out of Stanford University. It was good in predicting the exercise or physical activity rates with the white Caucasian population, because one of the salient constructs in that theory is that of self-efficacy, which is the behavior-specific confidence in one's ability to perform a given behavior. But when it came to minority populations and my work in other countries with social cognitive theory, I found that it was not very well predictive, especially with the African American community, for example. They do not believe that much in the power of self, but they believe more in almighty or a higher power. Same thing with some of the other Asian cultures, where the role of self is considered to be not that important. And like a deity may be influential, or almighty God may be influential, and things like that. So I developed that same thing with the other behavioral theories, like the health belief model that also has self-efficacy, or the trans-theoretical model that also has self-efficacy, And so I experimented with number of behavioral theories. Theory of planned behavior has also a concept similar to self-efficacy called perceived behavioral control. So I found that these theories were not suitable for across cultures. And so I developed a theory called the multi-theory model of health behavior change, based on the constructs from different theories. So one of the constructs is called as participatory dialogue. In participatory dialogue, this construct has been derived from Paulo Freire, who was a Brazilian adult educator who talked about how to educate adults. And he talked about the two-way communication. So in this two-way communication, we highlight the advantages of behavior change over the disadvantages. So what it does is that it helps a person motivate for the behavior change. So people who may otherwise think of themselves not highly motivated to starting physical activity or exercise by saying an immediate advantage, such as the benefit to their health, or benefit in their appearance. For young people, appearance is very important. Like, for example, they may be interested in going on a date. So that type of a thing may appeal to them. So those kind of personal benefits, personal advantages, and outweighing them over the potential disadvantages, like the cost of joining a gym, or not having enough time, or those kind of things, in that kind of an interaction, we are able to underscore the advantages over disadvantages. So that is the first construct. And the multi-theory model of health behavior change divides the behavior change into initiation and sustenance. Initiation meaning the starting of the behavior, and sustenance meaning maintaining the behavior. So this participatory dialogue is important in initiation or starting of the behavior. The second construct that is important in initiation or starting the behavior is that of behavioral confidence. Now, behavioral confidence is somewhat different than self-efficacy, because the source of this confidence can be an entity. It can be self, but it can also be an entity outside of self, such as almighty, or a powerful other, somebody, a young person, a child may have confidence in his or her father or mother. So that play a role in developing that behavioral confidence. So once that behavioral confidence is there, then that is very important. And the third thing is changes in the physical environment. So changes in the physical environment is that there should be adequate availability, accessibility, and obtainability of resources in the physical environment. For example, if you're talking about physical activity behavior, then availability of a gym or a playground, or availability of, if you're talking about strength training, then availability of weights or some other type of things that may be available to the person. Because if suppose somebody is living in a congested environment in New York City and does not have the money to join a gym, then it is very difficult for that person to become physically active, So that type of approach should be available, that physical environment. So these three constructs or these three factors, these three correlates are important for starting physical activity behavior change. And then there are three factors that are important for maintaining this behavior change. Among them, the first one is emotional transformation. So we all have feelings. And if we can mobilize our negative feelings, like, for example, we are getting angry or frustrated. If we say, well, instead of getting angry or frustrated, I'm going to devote the same energy to doing push-ups or running around the block. So setting up some concrete specific goals for physical activity by transforming our negative feelings into goals. So that is very important for maintaining the behavior. And then another construct or factor is practice for change. Now, practice for change is derived once again from Paulo Freire's work, which talks about Freirean praxis. Freirean praxis means active reflection and reflective action. So what that means in simple terms is constantly thinking about behavior change. So you can keep a journal, you can keep a diary. These days we have a lot of apps that record our physical activity. I use an app on my cell phone which records the number of steps I do, and I try to incorporate 10,000 steps every day. Today I had a meeting with you, so I have only been able to log in about 3,000 steps. But right after this meeting, I will again go for a walk and try to meet my goal of 10,000 steps. So that is the kind of practice for change. And then the third important construct is changes in the social environment. So changes in the social environment pertain to things like social support, like support from family, friends. So you can mobilize that. In some cases, health professional, like you are a health coach. So you can provide that kind of a support to your clients in order for them to engage in physical activity. And also these days, the social media is becoming a very popular thing. So if you can mobilize support through social media, like a lot of WhatsApp group are there, or you can post, I have a friend who posts her physical activity on Instagram. So she gets a lot of likes, so that's another form of mobilizing that changes in the social environment. So these are some of the ways that I have applied behavioral, empirically based approaches in increasing physical activity behavior in a variety of populations. My work has been with African American community, with Hispanic American community, with Asian American community, and of course with the general population comprising of mainly white Caucasian populations.
Very good. Yeah, it's very interesting to think that some people would believe in like a higher power, not controlling them, but I guess supporting them to make a change. That's something I never considered, but I see a lot in other people. You see athletes mention, oh God, allow them to do this. So that's very interesting.
Yeah. It's a very huge concept in the African American culture. I have guided dissertations, doctoral dissertations of 50 or 60 African American students. And invariably in all of them, in the acknowledgements, they start by saying, I want to thank Almighty. That is the first sentence they would write in the acknowledgements, which we do not find in many other cultures.
Yeah, I think there's a lot of use for that because they think they're more humble because of that. They don't believe that they're like this amazing single person who, they did it all themselves, because We need
that
support.
humility is very, very important and is a very strong strength of the African American culture and some of the minority cultures. The humility is a big thing. Unfortunately, in the United States, we have a lot of big egos. And that is, I have found that is pretty detrimental in our spiritual progress.
Yeah, absolutely. I think in America, individualism is celebrated when it's not really something that is as important as the group or just to have some humility even. But just one thing that I've noticed recently, I saw there's an advertisement. A female basketball player, Candace Parker, she's trying to get more women to be more active because as women get older, you're the researcher, you can correct me, but I think women, their participation in sport drops off a lot more than compared to men. Is that right? And why is that?
Generally, with age, the participation in sport activities and physical activity declines, and that is responsible for a variety of problems. Osteoporosis and cardiovascular disease and depression, especially with menopausal women, we find a lot of higher rates of mental health issues like depression to be more common, and osteoporosis, of course, is a big problem. So a lot of problems happen with declining physical activity and exercise with age. So there should be physical activity at all stages of lifespan.
Yeah, absolutely. With the decline in bone strength as we get older, it's even more important to be active as we age. So then your current areas of research that relate to mental health. So you focus on stress and coping, as is in one of your books. You look at yoga, you look at meditation, and then introspective meditations. Could you speak about those topics and just explain how they help to improve our health or manage our health?
Yeah, mental health is a big problem in our country. And after the COVID-19 pandemic, it is becoming a major problem. People have been socially isolated for a long period of time, and also the adverse effects of COVID. There is a condition called as long COVID, which has affected a large number of people. And then, so anxiety levels, depression levels, other mental problems have been increasing in our society. And in general, we do not do a very good job with coping with the stress. Because like you mentioned, we are an individualistic society. So we tend to personalize everything and take responsibility of all the stressors on ourselves. So that is the problem with stress in our society. The internal locus of control puts a person at greater amount of stress as opposed to an external locus of control. And oftentimes we forget that it is not the stressors that are causing the stress, but it is the perception of the stressors that is causing the stress. So in my work, I have written a book called Practical Stress Management with my co-author, Dr. John Romas. In that, we have described various attributes of coping with the stress. There are different types of stressors. There are stressors that are acute stressors and chronic stressors. Acute stressors are once in a while life events. So once in a while life events are like, for example, you meet an accident or you have a divorce or even the nice aspects like you win a lottery or you enter into a marriage. So those are like once in a while type of stressors. And they can, of course, produce some amount of stress in our life, and the stress is of two types. Eustress, which is the good stress, and distress, which is the bad stress, which can cause negative sequelae, like harmful diseases that can happen, like effect on heart disease or depression or anxiety or post-traumatic stress disorder and things like that. So, and then the second category of stressors are the chronic stressors. So these chronic stressors are things like, for example, daily hassles, like you have to deal with traffic or stand in a queue. If you're living in a bigger city, then these things are part of your daily hassle. So that's one type of a chronic stressor. Another type of a chronic stressor is a community-wide strain. Now, that is, for example, you happen to be a minority in a majority group, and all of us are minority in some respect. When it comes to a majority, we may be a minority by our education. We may be a minority by our gender in a group. We may be a minority by our race in a group, and so on and so forth. So whenever that type of a situation arises, then that can potentially cause a problem. And then there are chronic strains. For example, you live in a high crime neighborhood, so that is causing you stress. And then there are role strains. Just by having multiplicity of strains, or by having different one particular role may be stressful to you. So that can also cause stress in you. So that is another type of chronic stressor. And then there are some persistent life difficulties. For example, you met with an accident, an acute life stressor, but now you are disabled as a result of that acute stressor. So you have to bear the consequences of being in a stress for a long period of time. So that is the kind of chronic stressors. So we talked about acute stressors, we talked about chronic stressors, and then the third type of stressors are the non-events. Non-events are like, for example, simply getting bored, which is very common in our society. Like people get bored, they have nothing to do, they cannot handle their own company, and as a result, they get bored. Or another type of a non-event is, suppose everybody in your age group has gotten married and you are not married, and you feel that, oh, this event that should have happened has not happened, and as a result of that, you are stressed. So those are the non-events. So all these stressors, it is, you have to assess them, and then have a sense of controllability. It is very important that one has a sense of controllability over these stressors, and that has to do with the perception that a person has. And a lot of my research has shown that it is that controllability factor that makes all the. So that can happen as a result of changing one's perception. And that is where the whole concept of yoga and meditation and introspective meditation comes into interplay. Like yoga is a system, it's an ancient system that was originated in the Indus Valley civilization more than 5,000 years before Christ. And in the remnants of Mohenjo-daro, which is now in some parts of India and Pakistan, you find people, some practicing yogic postures. So that yoga is basically based on 8 limbs. There are 8 limbs of yoga, which is called as Ashtanga Yoga. So the first limb is the yam niyam. These are the various practices, like the 5 do's or 5 do's for self-regulation and 5 rules for living in society, like non-stealing or worshipping of the Almighty and things like that. So that is for cleansing the body and mind, yam and niyam. And then you have the asanas. There are thousands of asanas, but you can choose some of them for practicing, for maintaining the body in good harmony with the environment. And then there is the pranayama, or the breathing techniques, which can help in circulation, breath, and induce diaphragmatic breathing. We do not do a very good job of using our diaphragm in breathing. So that's what pranayama does, channelizes the activity of the diaphragm. So these 4 limbs are called as the outer yoga. Then we have the 4 inner yoga, the Pratihar, Dharan, Dhyan, and Samadhi. Pratihar is detachment of mind from sensory objects. And then Dharan is concentrating on object, and Dhyan is the meditation part. And then Samadhi is the meditation with the super consciousness. So I have developed a system of yoga called Kundalini Energy Yoga, which imbibes some of the basic asanas, some breathing techniques, some practices, like healthy eating, vegetarian diet, physical activity, relaxation, and then sequential meditations, meditation on breathing, meditation, mantras, meditation on various chakras or the endocrine glands in the body, and then meditation, the super consciousness. So based on that, I have done some studies with anxiety patients, with smoking cessation, with depression, with understanding the meaning of life, enhancing an understanding of life. I have found pretty good results with the limited number of studies, and I plan on doing more studies in the future. So the Kundalini Energy Yoga is based on meditation. Different schools of yoga start with different aspects of those Ashtanga Yoga or the 8 limbs. So the Kundalini Energy Yoga starts with the meditation and thinking, or introspective meditation. Introspective meditation is meditation on your thinking, so that you are not too much focused on the past or future, but you are trying to self-improve your present thinking. So we all face dilemmas, like whether to engage in a pleasurable activity, whether to get angry with a situation, whether to get anxious over a situation, and so on and so forth. So I've identified 25 such dilemmas and identified some steps for self-reflection, introspection on those as part of this Kundalini Energy Yoga. And we've conducted some studies in that regard. So that is a brief background of my work with stress coping, with yoga, with meditation, and introspective meditations in particular.
Very good.
There is a book that I have written called Introspective Meditations for Complete Contentment, that is available on Amazon for a very inexpensive price. And if you want a copy, I can send you a free copy of that book. I distribute it free to people who.
That would be amazing. Thank you very much. Yeah, I'll attach the show links with the links to your books as well. I think being able to cope more effectively with life challenges is always a good thing. And I actually have COVID right now. So I actually got it over the weekend. I'm recovering. I'm feeling a lot better. But it's funny you mentioned.
I'm sorry to hear that. I didn't know that. So I hope you took all the vaccines and everything.
Yes, I did. And
so hopefully it will be a mild episode for you. And I wish you the very best.
Thank you very much. Yeah, I'm on the mend now, but yeah, I just have to isolate and do all that kind of recovery stuff. So that's where I'm at right now. But you spoke about a little bit about like meditation, and something I'm learning recently as well is just like, to be connected with the present moment. So just to be kind of aware of like the here and now, not to think, about the past, like, oh, I could have done this better, or in the future, what's coming up. Is that a big part of your work, to improve people's health, to help them to stress less, to cope better, to connect with the present moment? Is that something that you work on?
Yeah, that is the first step of what is popular in the West is called as mindfulness. So mindfulness is focusing on the present, but one should not stop just at mindfulness. Mindfulness is like the first step in meditation. So when you are not bothered about the past, not focused on the future, you are on the present, then the journey of meditation starts. So that is the step that we talk in yoga as the dharana or pratihar, detachment of mind from sensory objects and focusing on one object. So what should be that object? Just focusing on the present is not sufficient, because the mind will keep on fluctuating. So what we do in Kundalini Energy Yoga is we focus on the inner energy. Like, for example, we have the body and we have the brain, but there should be some source of the energy, just like you have in the electrical system. You have the electrical wiring, and you have the switches, and you have the bulb. But unless there is an electric current, you cannot turn on the light. So there must be some inner energy. And that inner energy comes from the food that we eat, the breath that we take, and from the ultimate source, which is the Almighty, or the primordial static state we call in yoga. So that is the source of the inner energy. So in Kundalini Energy Yoga, what we do is, first of all, we make our mind calm by focusing on the present, and then we focus on this inner energy. Now, that can be done with the help of starting with the breathing first. So we start focusing on the breath, and that is breath observation is the first step. So that is after calming your mind with introspective meditation or mindfulness meditation, bringing it on the present, and then you focus on the breath, the mind becomes more oriented to the present. And then you can focus on any sound like Om or Amen or any sound vibration. So the mind becomes even more focused, more attuned. And then you can start relaxing your senses one by one. There are 6 senses, like the taste sensation, the touch sensation, the smell sensation, the hearing sensation, the kinesthetic sense, the sight. So you relax those senses, and then you can go into the various observation points of this energy. So the first center of this observation is at the base of the spine, which corresponds to the endocrine glands, the sex glands. So at the sacrococcygeal region, if you focus, you will find this kind of an energy vibration. It is in the form of a vibration. And then likewise, you move up to the suprarenals or the adrenal glands, and then you move up to the pancreas, the navel center, and then you move up to the heart center, and then you move up to the throat center, the thyroids, parathyroids, and then you move up to the point between the eyebrows, the pituitary gland, and then you move up to the crown of the head, the hypothalamus or the limbic system. And that is where you basically start feeling these vibrations get stronger with concentration if you've done the previous steps diligently. And then at that point, you start expanding the consciousness into the entire cerebral cortex, or everything that you have conceptualized in your lifetime, the whole universe. And then going beyond the universe, you merge into the super consciousness. So that is the process which comes with practice. It cannot happen overnight, but we keep trying and trying till we succeed. And that is the whole purpose of the meditation.
Very
so
good.
Meditation is helpful in helping with the various diseases. Like my research has shown that it is helpful in alleviating stress. It has been helpful with cancer patients deal with the various problems of chemotherapy, radiotherapy, etc. It has helped with depression. It has helped with anxiety. It has helped with diabetes. It has helped with Parkinson's disease. In pregnancy, it has helped in smoking cessation, in arthritis, in bronchial asthma, in hypertension. But these are the kind of byproducts. The main purpose of meditation is to find meaning in life. All of us are born with a purpose. The life has a purpose. And that purpose of life is what is the whole, and living in harmony. That is the purpose of meditation, living in harmony of the body, mind, and environment. So, like Viktor Frankl, who was tortured in a Nazi camp, he said, my purpose of life is to help others find meaning in life. So that is the kind of the essence of yoga and meditation.
Brilliant. Yeah. So if somebody hasn't experienced these benefits of yoga and meditation, like let's say they're struggling to go to the gym and work out or wherever they want to exercise. Maybe they're like socially anxious, or they just kind of they feel like they are incapable of exercise. What would meditation help in those type of situations? What benefit could they notice?
Yeah, meditation help them focus more on whatever tasks that they are doing, because it's a method of harmonizing your body, mind, and environment. So the more you become conscious of the inner energy, you can direct it. In my case, I direct it more to research and teaching. So I benefit in that way. So if you're directing it in a gym for a workout, then you will get more benefits out of a workout. You will have a better body. You will have better physical outcomes. So wherever you want to channelize it, it helps you channelize your energy in that direction. Whatever your purpose of life is, you can benefit. Like you are a health coach, you want to help others develop good bodies. So if you practice meditation, if you practice yoga, then your acumen in teaching others, with coaching others with physical exercises will shine.
Yeah, so you can apply more of your energy to one task as opposed to being split in
absolutely. So whatever task you have at hand, you can become more proficient in that task in more worldly sense. And in a spiritual sense, you gain more out of what is the purpose of life, why you were born, who created you, what is this creation. So all those esoteric questions, you can find answers, because the answers to those questions lie within you. They do not lie outside of you. That is the philosophy of yoga.
So, Manoj, we're seeing a rise in the use of screen time, phones, computers, all of these kinds of things. What are some of the effects of the increased use of screen time on people's mental health?
Yeah, we are seeing a lot of increase in the screen time, and unfortunately, I don't foresee that it is going to stop in near future. If anything, it is going to increase. Just like, we had the television and then people started watching television more. And now with the cell phones and with all the social media, people are constantly engaged. So what is happening as a result is constantly people are having multitude of thoughts. The mind is constantly engaged. The mind is not getting rest. It is very important for the mind to get rest. When we fall asleep, our mind is sleeping and is at rest. Sleep is very important. Like, we have the electroencephalograph. Like right now we are talking with each other, the mind is engaged. And if we record the EEG pattern, we will find that the mind is at the beta wavelength, which is like 14 to 40 cycles per second. Then as we start falling asleep, the mind goes into alpha waves, which are 4 to 13 cycles per second. And then as we go deeper into sleep, we go into theta waves, which are 1 to 3 cycles per second. And then ultimately we get the delta waves, which are less than 1 cycle per second. And with the practice of yoga and meditation, people have also gone into the omega wave, which is 0 cycle per second. So the delta wavelength in a normal 8-hour cycle is about at the most 2 or 3 minutes is what we get. And if for some reason we don't get the delta wavelength, our next day is totally spoiled. We do not get the recovery. So what happens with the constant engagement of mind and activity with different thoughts that social media provides is that the mind is constantly in beta waves and sometimes even gamma waves, which are even beyond 40 cycles per second, jumping from one topic to another topic and constantly waiting for a reply. So that leads to fast processing and constant engagement of thoughts. So that is good in a way that we are able to accomplish a lot of worldly tasks. We can multitask at the same time with video conferencing that has become very common in COVID-19 times, I find that I can attend 2 meetings, on video conferencing at the same time. So, but that multitasking is not very good for our mental health. And constant engagement of thoughts is not very good for our mental health because it does not provide adequate resting of the brain. So what I advocate is that for every 1 hour of activity, we should take a break in which we should make the mind calm by meditation. Okay? Simply reducing the wavelength of the mind, starting with that mindfulness and then going through the various breathing and the mantra and the other steps, maybe 5 to 10 minutes one should devote every hour to calm down the mind, to really reduce the harmful effects of social media, which is growing at an alarming pace in society. So there are other techniques for relaxing the mind also. If somebody is not motivated for meditation, then one can practice things like creative activity or humor or progressive muscle relaxation, autogenic training, or those kind of techniques, are also other alternatives that can be employed. But the most important aspect is relaxation of the mind as a result of this social media bombarding of constant thoughts.
Yeah, I heard the idea that we have like a content diet. So let's say you're on social media and something, you consume something, like it might be funny, it might be sad, it might get you angry. And we have to be mindful of the effect it has on us because it can get us kind of like worked up.
Another problem with social media is that of comparisons, especially in the younger generation. People Photoshop their pictures and then they post them in the best possible angle. And then the pressure is, suppose somebody is little overweight and that person photoshops the image and posts a young and thin version of themselves. And then the pressure on the peers is that, oh, this person lost weight, whereas that may not be the real case. But that comparison becomes a big issue and the body image becomes a big issue. So that is also a growing trend in our society, which is causing problem with the social media.
Yeah, absolutely. To compare ourselves can really get us stressed out when maybe there's no need, or it's just
right.
We wouldn't otherwise do it if we weren't, using the screens. So yeah, that's very important, and mindfulness as well, and taking time away from such a worked up state will definitely help to reduce our stress. So Manoj, that's everything. Thank you very much. Is there any final message you would like to leave with the listeners to mention before we wrap up?
Yeah, I think for general stress management, like I mentioned, understanding of the stressors is important. Relaxation through yoga, meditation, and other techniques is important. Also, managing anger is very important. One should try to avoid getting angry. That comes with introspective meditations. And the same thing with reducing worrying or anxiety is very important. And that also comes with introspective meditations. Improving one's communication is important, that comes with assertiveness, that comes with understanding different behavioral styles. And then regular physical activity, regular healthy nutrition, managing time is very important. And then also, I have seen that a major source of stress in our culture is related to finances, and we do not pay too much attention to saving, and we live off our credit cards. So, judicious use of how we are spending our money, awareness of spending, budgeting, and then saving money, investing money. Those are very important things to keep in mind to avoid stress. And then finally, setting goals. So one should set goals, long-term and short-term goals for self-improvement, reducing stress, and professional success, personal success. All those things are very, very important.
Brilliant. I'll make a list of all of those points. I'll attach them in the show notes. Manoj, thank you very much.
And, thank you, Ross, for having me. And I really appreciate your willingness to take on me. And I wish you the very best and your audience the very best in their personal and professional lives. By the grace of Almighty, all of you may enjoy excellent health, long lives, insightful wisdom, lasting prosperity, total peace, and complete contentment.
Brilliant. Thank you. We'll apply your advice and we will achieve all of that. Thank you.
Take care. Bye-bye.
This podcast is sponsored by BetterHelp. That's Better, H-E-L-P. BetterHelp is an online therapy service for anyone who is feeling down, depressed, stressed, anxious, or overwhelmed. BetterHelp is here to help. During the pandemic, it was a particularly tough time for me, and I found that BetterHelp was invaluable. The therapist I matched with was very effective, very understanding, and really helped me to cope with the challenges of the pandemic when I felt as though I was a little bit overwhelmed. So BetterHelp offers licensed therapists who are trained to listen and help you. You talk in an online environment. It's private, it's safe, it's secure. And how it works is that you fill out a questionnaire, they assess your needs, and then you are matched with therapists in under 48 hours. They have over 20,000 licensed therapists, so they have a huge network, and you actually can choose your therapist also. They schedule phone sessions on a regular basis, and if the therapist you're matched with is not a good fit for you, you can always request a new therapist at no additional charge anytime. It's a great service. I've used it. I believe in it. I highly recommend it. And it is also affordable. So for listeners of this podcast, I will attach a link where you will get a discount, and it will help you to get started to better manage your mental health.